Welcome back. It's 8:11 here on this Saturday morning. The long-term effects of concussions are becoming a more talked-about injury in the NFL. It's taken many players out of the game, including a former Gopher and NFL player, Ben Utecht. The injury ended his football career, but he is now speaking out about its effects.
At 28, to start experiencing memory problems and cognitive changes was quite alarming.
Well, now new studies are showing that we still have a lot to learn about the injury. Today, we're joined by Dr. Tarrel, neurologist from the Neurological Clinic, to talk about this. Good morning.
Good morning.
So let's talk about the study that has found this. We're becoming more and more aware of what these injuries can do.
Exactly.
The long-term effects.
Exactly. And what we're finding is that with more and more research, we're coming up with more and more data. We still have to get to the point to make conclusions about them, but there's information about blood flow to the brain that is now lasting longer than the patient's symptoms are, the person's symptoms are. So there's a question, are they getting to return to their normal activities or to their play in whatever sport they're in too early? And then there's other information about changes in the brain itself that are present in individuals who may not have ever manifested the symptoms of a concussion or head injury, and we don't quite know the implications of that.
Even if you casually watch football or any of the other sports where there's a contact, you can see that we've changed the way we deal with concussions immediately. Maybe they stay out of the game a little longer, but are they still going back too soon?
It's a question that needs to be answered, and again, the recent study that was done demonstrated decreased blood flow in the brains of people who were diagnosed with concussion for longer periods of time than their symptoms. So even, again, if it was an athlete and they returned to the field, they found that these individuals still had decreased blood flow in the brain. Nevertheless, they were functioning relatively well. So this data is coming in that we're going to have to look at, and it'll lead to further studies so we really understand, is it the findings in the studies and the findings in the brain that we have to treat and manage, or is it the findings and the symptoms of the person themselves?
We were just looking at video there of some young kids playing football, and I think the parents that are making that decision for their children, they're wondering, should kids be playing these impact sports?
I think it's really too early to start limiting these activities that kids and adults participate in. Concussions are becoming diagnosed much more readily because we're finally more aware of them and we understand the symptoms. But that doesn't mean that we have to stop doing the sports we love to do and the activities we love to do. What it means is we have to learn what safety precautions to take, what kind of changes lead to diagnosis of concussion and head injury, and then how to manage it.
All right, Doctor, thanks for coming in. We appreciate your time this morning talking about what is a very important issue, and it's becoming increasingly common as we talk about it more and more. Thank you for coming in.
You're welcome.